What exactly are the injectables? How are they used?
So injectables, we have a few different options out there. The most common that I think patients are familiar with would be Botox. Botox has been around for several decades now. We use it for multiple different reasons to soften lines and wrinkles on the face. And then we also have a new generation of products which have been out for the past 13 years. These are your products like Restylane, Juvederm. These are actually injectable gel fillers that we inject to help increase volume in the tissue.
How are those different from Botox?
So Botox is a neurotoxin. It's a neuromodulator that actually attaches to the muscle and prevents it from being hyperactive. Whereas the injectables that we use they're made of hyaluronic acid, which is a component that is part of our collagen, and it actually inflates the tissue.
So we're looking at, between the new material, we're looking at something that is more biological than the Botox?
Yeah, it's kind of biostimulatory in the sense that once you place this injectable gel, it sort of takes up this space that has either been deflated over time due to age or fat loss, and we're able to reinflate that tissue so that it gives a more youthful appearance.
You mentioned age again. How old can you be? Does it matter what age when you get an injectable?
Not really. I would touch on the fact that younger patients are getting into these procedures more and more. It's more common now thanks to social media. So whenever I have a patient that comes in, I usually would like for them to be 18 or older. It has to be a very specific reason why we're treating somebody younger with apparent consent.
Now that's interesting because I recently read a story where there were parents who allowed their 16-year-old daughter, they signed off and allowed her to have injectables. That's not really a good idea because, and again, I'm not a doctor, I just play one on TV, of course.
Of course.
But the body is still growing. You're still at a very youthful age. Is that fair to say that that's the right thing to think?
It wouldn't be a personal choice of mine. You know, I have a 2.5-year-old, so I'm thinking about those things as well. But it is a case-by-case basis. It depends on what it is that we're treating or how we're treating it. Maybe we're correcting something that was a previous surgical scar, and we're trying to improve the appearance and make it look better. So there are some benefits to doing that. It's not just everyone coming in to get their lips done.